What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
I'm doing good. I think this podcast is relevant to everybody that wants to have a baby.
Right.
But specifically, we're going to be talking about male infertility and semen analysis. And I think it's a very important thing to talk about because most of the time in our seemingly patriarchal medical system and society, a lot of times couples that are infertile, and we're defining infertility as trying to have a baby for at least a year and not being able to. And when these couples go into a fertility specialist or fertility clinic, most of the time, the onus is on the women. Oh, it must be something wrong with you.
Yeah, it always seems that way. Couldn't agree more.
And that's not true. And that's not true based on the science. And one thing that rarely comes up, especially when you're talking to your doctor about it, is the person who gets tested the most is the female gender, right?
Mm-hmm.
Because I think most time the issue is with them. And what we do know about men is the male infertility rates have been increasing, I think, since we started measuring it since, I don't know, the 1950s, 1940s, at least this century. Semen quality is getting poorer and poorer, and there's many reasons for that. Nobody could really point the finger at one specific thing and say, oh, it's definitely due to that. And we'll talk about that in a little bit. But also, a lot of the problem as far as pregnancy rates go can be due to men. And some estimates will say they're at least half the problem, which kind of makes sense. So why not always test them?
Yeah, absolutely.
Right?
So is that how infertility is defined, Keoni, like in the medical community? Or is that how we're defining it kind of going forward for this episode?
It's defined as a couple trying to get pregnant for at least a year without any success.
Okay. And when people do semen analysis, are we only looking at like sperm count, or are there, are we putting it between our fingers and
No, we're definitely looking at sperm counts, but we're also looking at other factors. And the main ones being motility, so how do the sperm swim, basically, and then morphology. What's the shape of them? You can imagine.
All right, so we're definitely focusing on like the properties of the sperm.
Yeah, definitely the properties of the sperm. But male infertility specifically refers to the man's inability to cause pregnancy in a fertile female, right? And in humans, it accounts for about 40 to 50% of the infertility rate. So that's pretty high. And they're saying that it affects at least 7% of all men. I've seen factors much higher than that, though. I've seen things that say much higher than that. And it's most commonly due to deficiencies in semen, the quality, and fecundity, meaning, basically not being able to have a successful pregnancy, and a successful live birth. So the medical name for male infertility, has a pretty long name, and sometimes they're used interchangeably, but oligo, right, having few sperm. So oligospermia, asthenospermia, not really having the, not having the motility to get there, and teratozoospermia, which is basically, the morphology is really messed up.
Okay.
And then azoospermia means just basically lack of sperm in the semen.
Mm.
So you hear all those
Scrabble game.
Yeah, with that, right? You hear all of that. The nice thing about this for most men is this can be easily taken care of.
Okay.
And we're going to talk about that because for most men, it's as simple as really just putting them on a high potency multi and antioxidants that have a lot of research showing that they help improve sperm quality. And when I say sperm quality, I'm talking about all those factors we just talked about: motility, morphology, count.
So is it rare that it's a kind of linked to some sort of genetic thing?
It is rare. Most of the time it's idiopathic, meaning that there's no known cause for it.
Okay. Which then, I mean, kind of makes sense as to why we can address it with more success.
Right. Now, there are other issues, right? I mean, you know, physical trauma to the testes, that definitely will account for problems. I mean, the nice thing from an evolutionary perspective, the testes sit in a bag, right? That if there's a blow to that bag, it gives, right? It's not a stationary thing where it would, really bruise you. But yeah, getting blunt trauma can definitely cause problems and can partially and fully cause infertility. Also, chemicals are an issue. So many toxic substances will cause low sperm quality. And this is environmental toxins, right? Environmental mutagens, things like heavy metals, pesticides, herbicides, solvents, all of this stuff. When couples come into my clinic and want to use like acupuncture and natural medicine for improved infertility, I mean, these are some of the things we go through. We talk about, okay, what is your exposure? What is your burden, toxic burden? And then we also reduce that too. Other chemicals out there like endocrine disruptors, these things you can find in like plastics. Again, it's like the herbicides, pesticides, PCBs, DDT, anything that leaches like volatile organic compounds, anything like that, usually if you're exposed to that will cause issues. And it's just amazing to me how quickly these things can cause issues. And then what's even more amazing is how quickly, if you decrease your exposure, how quickly you could improve the morphology, motility, and sperm counts.
I know this is kind of like one of your areas of, I guess, love, Keoni, is how do you, other than completely not being exposed to these things, what type of things or measures can you take to reduce your exposure to these things in everyday life? Knowing that, like when I, go for a walk here in Florida, I'm getting hit by some irrigation and I can smell the chemical that's in there.
Right. Well, the main thing is try to decrease your exposure, all right? And you're never going to be able to decrease completely exposure. I mean, right now, me and you're being exposed to stuff. But one of the ways to mitigate that is through nutraceutical supplementation.
All right.
Drinking plenty of water.
Yeah.
Trying to upregulate your own body's natural endogenous detox mechanisms, making sure you're sweating, making sure you're pooping, making sure you're peeing, that type of thing, making sure you're sleeping appropriately. All of that stuff helps. But sure, I mean, if somebody comes into me and there are two things. Let's say they come into me and they're a runner and they're like, I run every day for, 5 to 10 miles every day. First of all, I'd want to decrease that for one thing, because excess exercise has been shown to decrease sperm quality a little bit. Okay. It's not the main factor, but the other thing is, where are you running? Are you running on a street that is, you're constantly being exposed to car exhaust and stuff like that? All those things matter. They definitely matter. But I would have to say it's low on the totem pole or high, however you want to, perceive it. It just pales in comparison to what, appropriate supplementation can do. I mean, if you go into a fertility specialist as a man, basically they'll have you go in there and go, well, we need to get a semen thing. They basically have a jack off room. You go in there. It's kind of crazy going in there, because you go into these rooms, they have it all, at least some of them have it nicely made, a couch with a little mat on it, and they have a porn TV right there. It's kind of fascinating. You would never expect something like that with women, okay, the female masturbation room, it just says something about, the male and how men are very visually stimulated, much more so than women, And it's just funny. It's very, the nurse there, it's very nonchalant. Okay, here's your cup, go in.
So it sounds like you've done this before, Keoni. You've had your.
Oh, I have. Yeah. Oh, yeah. I have. And I wanted to do this also, just because I wanted to do this for this podcast specifically, but also to see what the deal is and how it goes on, and just educate myself on how big of a problem it is. It's a big issue. And here's the thing about it. lot of heartache, a lot of psychological, emotional stuff with couples not being able to get pregnant, and especially for women, because it's usually the burden of being the problem is usually put on them. It's rare. It's actually pretty rare for a lot of docs to say, okay, well, let's look at the men. You know,
right.
It's like after they go through and rule everything out with the woman, then let's look at the man.
Yeah.
You know, and anyway, so I just think this is part of the reason why I think this podcast needs to be done. So when people come in my clinic, I will actually tell them, say, yeah, as a man, you need to get a semen analysis. You need to go do it, and let's see. And for both men and women to improve egg quality and sperm quality, it's fascinating though, and I've seen it on numerous semen analyses. If you supplement them right, those numbers bounce up within 3 months. Within 3 months. It's fascinating how powerful the supplementation can be for that.
Yeah. Okay.
I mean, it really like bumps it up big time. And it's, it just shows the power of nutraceuticals.
Right. Or like we've been saying for 100 and however many episodes now.
Right.
Just
and
being healthy.
Here's the other thing to think about with that. Like if you're thinking about getting pregnant as a couple, both men and women should do what they can to improve the quality of the sperm and the eggs, because with improved quality, it's less likely that you have more, SNPs and genetic abnormalities and stuff like that. And that's borne out in the research. You have less DNA fragmentation. That's one of the tests they run to look at why couples aren't getting pregnant. And basically what that means is, you're looking at the sperm and the egg and cells, and you're making sure that the DNA just doesn't break apart. I mean, if the DNA breaks apart, you're not going to be able to get pregnant. So, and supplementation really improves that and keeps the DNA stable. So when the gametes, the sperm and the egg meet, you're going to have everything go the way it should go.
Yeah. And just to be clear, I know we're talking about male fertility here, but you've seen it on the other side as well with supplementation, that sort of thing that we're referring to. You can really...
Yeah. Well, most women, right? Most women, if they're thinking about getting pregnant, their OBGYN will go, oh, let's put you on a prenatal. I mean, that's right away across the board. They don't say anything about the men.
That's a fair point. Yeah.
Yeah. And most, in my clinic, I definitely put both the men and women, not only on a good multivitamin, for women, a good prenatal, which is definitely different than what the men need to be on. But also at the very basic, that and fish oil, high amounts of DHA and EPA, which are found in high amounts of fish oil. And it's a dramatic improvement.
Yeah. And we've seen that bore out the research. And
I've seen it borne out in clinic.
Yeah.
And we'll go over some of these studies in just a second. I just want to go over, but there's also medications are a big deal for decrease in sperm quality. Okay. Many psychoactive drugs, including antidepressants, antiepileptics, propranolol, things like lithium, blood pressure medications, opioids, calcium channel blockers, testosterone replacement. How many men are on testosterone? Most common.
Yeah.
How many men are, especially men and 35 and above have been recommended testosterone replacement. Well, that or long-term anabolic steroid use can ruin sperm quality. Cancer medications, antifungals, antibiotic medications. I mean, it runs the gamut, right, with the medications. I mean, so this plays a role.
Yeah, absolutely. And I'm hearing some of the most common ones.
Right.
Right.
Let's talk about diet and how that influences too, right? This is kind of astounding to be, but there's a lot of men in our society that drink over a liter of Coke a day. And that is astounding to me. Anyway, 1 liter of Coke a day. I don't know what a liter of Coke is. Is that like 4 or 5?
Those big cans? Bottles are 2 liters. So half of one of those big plastic ones. That's a lot.
Yeah. All right. Well, yeah. Anyway, that seems to decrease sperm quality by up to 30%. Again, the study claims this is more of a correlation and not actually causation. A lot of these diet studies show that. But again, that's what I would do for people. It's like, okay, what does your diet look like? What soy products are you eating? Are you doing a ton of like phytoestrogens, isoflavonoids, things like that, soy products, those things also may have an influence. One thing that's very interesting, I try to avoid them as much as I can, but I love potato chips. And, some of them are actually cooked in cottonseed oil, which is terrible for sperm quality. You definitely do not want to have potato chips cooked in cottonseed oil.
Interesting.
Yeah. And that's definitely an association with low
And
sperm
that's
quality.
over. I wonder what it is about that, those specific properties of cottonseed oil. Because yeah.
There is a study out there that found like the typical Dutch diet, right? And I'm talking about Dutch from the Netherlands, Dutch diet, rich in fruits, vegetables, potatoes, meat, full fat dairy products, seafood, and even pastries. Yay. I don't know how they got this, but seems to improve sperm counts by up to 50%. So there you go. Maybe have a pastry or two if you're trying to improve sperm counts. I don't know why that's in that study, but anyway, the sperm counts seem to be very good. Some other things that are just kind of interesting. The differences between like artificial insemination, basically jacking off in a cup, as opposed to natural insemination, actually intercourse. It makes sense intuitively, but intercourse has better rates of getting pregnant, right?
Yep.
But it is interesting because basically you are doing that a lot of times with like IVF or whatever.
Mm-hmm.
There are a lot of women out there who want to get pregnant and may have a friend or something jack off in a cup or whatever. And it's, if you really want to improve it, it's better to actually have intercourse, according to some studies.
Yeah.
Things like this is interesting, longer periods of abstinence with sex. You would think that may help, and I think they're saying longer periods, we're talking about 10 days of abstaining from actual sex, actually correlates with poorer results, whereas abstaining for 3 to 4 days actually improves results. So there's like a little
interesting
bell-shaped curve a little bit. It's
if you keep the troops in the back too long, they just get lazy.
Yeah, right. And so basically, both too short of a time period between ejaculations and too long of a time period may reduce semen quality. So those things are just fascinating. I mean, other things are more intuitive, right? So smoking tobacco, of course. It seems like that's bad for just about everything. It's definitely not good for sperm quality or egg quality.
Right.
Unfortunately, cannabis lovers, me being one of them also, just, that may affect sperm quality. Okay. So I just tell people, like, if you're using cannabis products or whatever, and you're trying to get pregnant, it may be good to just avoid that for a little bit.
Yeah, absolutely. I know heat plays a role, because I got to shout out my favorite muscle, the cremasteric muscle. Creamaster.
Yeah.
I have a fantasy football team that I named the Mighty Creamasters. I did steal that name, but I did. Yeah. It is my favorite muscle. So it raises and lowers basically your ball sack, essentially keep your balls nice and the right temperature for sperm production.
Yeah, right. Which is a little bit lower temperature than your body temperature. So if your testes are like against your perineum with like tight underwear or whatever, that may affect sperm quality. Although the studies are not like 100% on that, but intuitively it certainly makes sense, because again, the creamaster muscle can't do what it does, right? If you already have them all crunched up against your body.
Yeah.
So absolutely, I think that's a big deal, and I do bring that up to my patients. It's like, what's better, boxers or briefs? If you're trying to get pregnant, probably boxers, or briefs that don't hug you so tight.
Yeah.
But again, there's other things that are more important in my opinion for that. But you bring up a good point. So what heat is a big deal, right?
Mm-hmm.
So if you're in saunas, if you're constantly like steam rooms and constantly doing that while trying to that does not help at all. That may make the temperature too high.
Right. Yeah. The whole point of that muscle is just to maintain the proper temperature for the production.
Right. So anyway, what about of course, we talked about unhealthy diet. I think the main factor for the unhealthy diet is an unhealthy diet tends to be a zinc deficient diet, and zinc is so important for sperm quality. All my men, I put them on a zinc supplement. We talked about zinc too for boosting immunity. I mean,
Yep,
zinc
absolutely.
is so important.
I told one of my favorite Keoni stories where we're sitting in the park or whatever, and Keoni flips me a pistachio and tells me it's good for my ball health.
There you go.
Pats me on the shoulder, sends me on my way. Thanks,
right.
Dr. Keoni.
That's right. That's right. Nuts, basically nuts.
Yes.
Are good for nuts. So yes,
There
getting the zinc level up there. Nuts are high in zinc, and as well as selenium, which is also good. That's why I just generally put people on a high potency multivitamin that really kind of covers all aspects of improving sperm qualities, at least from a nutritional perspective.
Yeah, and I mean, we're slowly covering like a comprehensive approach for, I guess getting prepared to want to have a child or try with being aware of all these different things.
Yes. Actually, and then also exercise, right? We kind of hit on this. Lack of exercise decreases sperm quality, but excessive exercise also decreases sperm quality.
So we got that bell curve again.
Yeah. So, I don't know what actually they're defining as. I didn't really look at studies, but I don't know what they're defining as, what's lack of exercise or excessive exercise. But I would imagine excessive exercise is where you're kind of, you're not able to exercise as intensely. You struggle through the workout, that type of thing. You're constantly doing something every day without letting your body recover. And then lack of exercise is just not being active, being sedentary, which also relates to possibly obesity, right? And truncal weight, which is also a factor in decreasing sperm quality. Other things that can certainly affect it, things like testicular cancer, any tumors of, the Leydig cells or Sertoli cells. These are cells that help with sperm count and sperm quality. Of course, those are going to affect it. Sometimes there's congenital issues like hypospadia. The vas deferens is there's a congenital aspect to that. That may be a problem, but these things are usually, you can go to the man and say, this is the problem. Retrograde ejaculation, where the ejaculation is in reverse, it doesn't actually come out. So that's another issue there. Sexually transmitted diseases, that's a big one, right? Past sexually transmitted diseases like chlamydia or gonorrhea. That's why it's so important to, if that is something, to get that taken care of right away. Varicocele, these are just basically large varicose veins in the scrotum. They may just prevent adequate blood flow. So that can affect fertility there also. And what else? A lot of this is kind of not directly related, but when we talk about things like preserving sperm, also like cryopreservation, it's basically where you freeze the sperm. Just the process of any assisted reproductive technologies decrease sperm quality, right? This is one of the reasons why a lot of these sperm banks and stuff are looking for younger men. When I say younger men, they really want men in their 20s. The sperm quality tends to be much better. Men, as we know, men are capable of getting women pregnant all the way up to the day that they die. But what happens is, with age, which is the biggest factor, right, for sperm quality and egg quality with women too, with age, is you're generally increasing the amount of genetic issues with the DNA and the sperm and in the egg, and you get more fragmentations, more SNPs, more problems with it, as well as the counts tend to go lower with age also.
Right. So we were going over some of those things that we can do. Can we circle back and just kind of highlight some of those things, like taking a good multivitamin, those sorts of things that you'll do when you address a patient in the clinic?
Yeah. So I will go back and go over that. But the main point is, I would, across the board, if there's a couple that's trying to get pregnant, the basics, what I have them do is, I would always have the man get tested as well as the woman, right? So we'll do a semen analysis. Whether that analysis is normal or not, I have the man on a high potency multivitamin and fish oil. I will also do the same thing for the woman, have them on a good high potency prenatal and fish oil. If that semen analysis comes back really bad, and there's no known cause, then I go into more specific supplements. So let's talk about that now. We know that approximately 30 to 80% of infertility cases in men is caused by oxidative stress and low antioxidant capacity. Okay, so we know that. So that tells us that we want to supplement with things that are powerful antioxidants. So this includes the multivitamin, but it also includes things like carnitine, CoQ10, N-acetylcysteine. N-acetylcysteine is a very, very powerful liver support supplement. It actually fortifies, is like a precursor to glutathione, your body's main endogenous antioxidant. Zinc and selenium. So, and fish oil. So I just wanted to go over these studies a little bit so people just get an idea. Out of the Clinical Nutrition, 2010, February, infertile men had lower concentrations of omega-3 fatty acids in their sperm than fertile men. Okay.
So there's your fish oil.
Yeah, there's your fish oil, right? Improvements in sperm parameters are like kind of like a dose response up to a certain extent with omega-3 fats. So 4-week supplementation seems to improve this. A meta-analysis indicates that supplementing infertile men with omega-3 fats resulted in significant improvements in sperm motility and concentration, and increased DHA, which is high amounts in fish oil, in the seminal fluid. We know that zinc is an essential trace mineral. I say probably the best for the male reproductive system. According to this journal article, Science 2016, zinc supplementation could significantly increase the sperm quality of infertile males. Okay. After N-acetylcysteine treatment, patient sperm count and motility increased significantly, whereas abnormal morphology, DNA fragmentation, and other problems like protamine deficiency showed significant decreases compared to pre-treatment levels. So everything improved. Yeah. Vitamin D has been shown to be very important for the male reproductive system. How many people are deficient in that? Most people are subclinically deficient in that.
Yeah. Yeah, we have a whole episode about that as well.
Yep. And then a Cochrane review determined that men taking antioxidants had a statistically significant increase in both live birth rates and pregnancy rates. So, I mean, it just goes out without saying that this is definitely something that's needed, and the onus is, may not always have to be on the women. Should, and nevertheless, even if the main problem is with the female, men can improve the fecundity of the pregnancy and the live birth by just improving their sperm quality and counts.
Yeah. Yeah. And that was a whole list of things that you can do. So it definitely seems like something you can hopefully address pretty easily.
Absolutely.
These nutraceuticals and lifestyle.
Right. And absolutely. And you can see it. You have objective data. You do a semen analysis. It looks bad. Okay. Supplementation alone, and then you see the improvements, dramatic improvements.
Yeah.
I've seen it over and over again. Dramatic improvements. Well, I mean, what does that say about our diet? It's kind of fascinating, right?
Yeah. 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 It's almost like we're trying to kill ourselves off in the long run.
You bring up a point here that's kind of fascinating, because it does seem like there's actually some articles I read out there that to be male, to be male, at least from a genetic perspective, you have an X and Y chromosome, right? And to be female, you have 2 X's. Well, that Y chromosome, which makes you male from a genetic perspective, it seems to, they think it's getting smaller and smaller and smaller, that Y chromosome. So it's like, where are we in a million years? Will there be any such thing as the gender male? We don't know. It's kind of fascinating.
Yeah, it is. And is there anything else, Keoni, overall? I mean,
no,
it seems like something can really address. It gives people a lot of hope.
It can be addressed so easily. It can be addressed so easily. And I just feel like as healthcare providers, we're doing a disservice to couples who are trying to get pregnant without addressing the men. No matter whether they have a normal sperm semen analysis or not. There seems to be room for improvement.
Yeah, absolutely. And if you go to our YouTube channel, you can see Keoni has a certificate from the semen analysis place that says best time. Congratulations, Keoni.
Yeah, it took me no time, actually.
Thank you for listening, everybody. We'll talk with you next week.
All right, take care.